A well-hydrated brain thinks clearly, learns deeply, and dreams freely. Today, we have the privilege of speaking with Dr. Aman P.S Sohal. He's a UK-trained consultant pediatric neurologist, neurophysiologist, and the founding partner and clinical director of Neuropedia, Children's Neuroscience Center in Dubai. With more than 2 decades of experience in pediatrics and extensive training in leading hospitals in the UK, before moving to the UAE, he has dedicated his career to understanding how the developing brain grows, learns, heals, and adapts. So let's explore one of the most fascinating frontiers of human understanding, the developing brain and the role of water in this process. Welcome to Waterlogs, and I am your host Priti Agarwal, a water sommelier. Doctor, it is a privilege to have you on Waterlogs today.
Ms. Agarwal, the pleasure and honor is mine that I'm sitting here in front of you. And thank you for inviting me on the show.
Thank you. Thank you so much. So to begin with, Doctor, can you tell us more about yourself and your journey so far? Where were you born? Where did you study? Did you always aspire to be a doctor?
Oh, that takes me back to 1995, 96.
Okay.
So I was born in India. Mm-hmm. I come from a family of army personnel. Mm-hmm. My father retired from the Indian Armed Forces. I did my MBBS in 1995 from Patiala. Mm-hmm. That's where I started my journey. Okay. Did I want to become a doctor from a very young age? That's a very difficult question to answer. But I had some influences on me from various people who met in my, life as in a school. Mm-hmm. There was one particular doctor who was very inspirational when I was in school. When I saw him, the way he carried himself, I think that was one of the reasons why I thought I should be doing this as a career. So I did my MBBS from Patiala, and then after I finished that, I moved to UK to pursue further training. I did my general pediatrics first, and then I decided to move on to pediatric neurology because there was another inspirational person in my life who actually egged me to do child neurology as a career. Mm-hmm. So I did my pediatric neurology training in Newcastle, which is north of UK. And then I was a consultant in Birmingham Children's Hospital for a couple of years before I moved to UAE. And the last decade in UAE has been an amazing journey for me as well. So this is in a nutshell for me over the past 20 odd years now.
Yeah, but see, the human brain is described as one of the most complex structures in the known universe. What intrigued you to do neuroscience, and that too specifically pediatric neurology? Was it your love for maybe spending time with children, or a commitment to helping the future generations?
Very good question. First of all, why did I do general pediatrics to begin with? Because lots of my friends, colleagues asked me the same question. Then why did you do that? There's a story behind it. Okay. And I haven't said this to any podcast because they're usually medical podcasts. Right. In this one, I can be a little bit free myself. So way back when I was thinking what to do after my medical graduation, I was posted in a pediatric ward for a couple of weeks because you can choose what to do as electives before you choose what you want to do as a career. And I was doing my evening shift there or night shift there. And I saw this young 6-year-old playing on PlayStation. And he was playing on PlayStation for a couple of hours. I thought, this is a good job. If I can sit with him and play, this would be a great job for me. And that was one of the reasons I thought I'll do pediatrics, particularly because it was very much fun. Yeah. Spending time with kids. Yeah. When they laugh with you, when they play with you, it was just amazing feeling. Yeah. And that's what helped me to take my career in pediatrics. Wow. Regarding neurology, when I was again in my general pediatrics, I came across lots of complex cases, particularly the ones who, some parents have given up hope on their children. They've got severe neurodisabilities and, they're going through difficult times. So I thought this would be a good career in which I can actually help the families who are going through so much. And that really, inspired me to take on child neurology. And one of my professors in Liverpool, she's the one who actually handpicked me. She saw how I was in her ward because she's a neurology professor. And she's the one who inspired me to take on this particular profession.
Oh, nice. Must be so fulfilling.
It is indeed. You come across So in neurology, you come across kids who you see in outpatients, who come to the outpatients just like any other outpatients, and they go home. And then there are ward patients who are admitted in the ward for long periods of time. So you see both kind of perspectives, both kinds of children with the parents who are going through difficult times. Helping each one of them is really fulfilling, really.
How nice. How nice. So the brain is made up of 75% water and depends on precise hydration to transmit electrical signals for eliminating toxins and to stabilize the mood. From a neurological perspective, can you help us understand how fundamental water is to the functioning of the brain and the nervous system?
That's a very, very good question, and something which gets asked quite commonly in my clinics.
Okay.
And the reason for that is one of the most common presentations which we see in pediatrics is headaches. Children's headaches is actually underdiagnosed. Children's migraines are actually underdiagnosed. There's a study which shows a huge proportion, 2/3 of kids, until they reach their teenage and become adult, have headaches which are underdiagnosed. So it's a huge number.
Interesting.
And one of the key features is water. Whenever a child comes with a headache, I tell them you should drink at least 1.5 to 2 liters of water every day. And there's a reason behind it. There is science behind it. Like you said, that brain's 2/3 of the brain is, or more than that, is made up of, or 3/4 of the brain is made up of water. If you get dehydrated, if you don't drink enough water, the cells of the brain or the neurons of the brain, the functioning changes with it. Because they don't have enough supply of nutrition, so to speak in layman language, because water brings it in the form of fluids which enters the brain.
Right.
So if you're not drinking enough, that's going to have a knock-on effect on your brain. Let me give you an example. In summers, I would guarantee you if you meet anybody in summers who says, oh, I did not drink water, and they come back by the evening and say, I don't have a headache. People will have headache in heat because the water just evaporates. Just like water evaporates, you lose water in heat. And if you don't drink enough, you get headaches. And there's your answer for that. Because brain needs water to function.
That is true. In fact, there's a recent research that suggests that even a 2% drop in the body water, which is so minimal that we may not even feel thirsty, can impair cognitive function to up to 12%. Yeah. Is that true? Because we focus so much on the body and we forget to see the impact of dehydration on the brain.
Absolutely correct. Yeah. Like you said, that the small change in water intake can lead to a big impact on your cognitive function. Now, you talk about cognitive function, there is neuroscience behind it as well.
Right.
So you have neurons. Neurons are the brain cells. Just like we have skin cells, they are brain cells.
Right.
We used to think, first of all, that you are born with a certain number of brain cells, and if one brain cell passes or dies, it doesn't come back. But now that theory is slowly getting debunked. There are areas in the brain, deep structures in the brain, which can have new neurons as well as you grow older. That's a new study coming through. Coming back to the water part of that, your neurons have neurotransmitter, which send signals from one neuron to the other.
Right.
To have those neurotransmitters, you've got to have some sort of fluid which is running through them. And the water plays a huge important part of that. If you reduce your consumption of water, or like you said, if you drop a little bit of percentage of water in your body, the neurotransmission through those neurons slows up because body is trying to conserve whatever they can or it can. So the transmission of the signals from one neuron to the other starts to slow down.
Right.
And if you look at it at a macroscopic level now, if you are dehydrated and you're not drinking enough, the way you are thinking in the morning when you start your work, when you're fully hydrated, as opposed to the end of the day, the way you think, the speed of processing of information will be slow. You've got to tell people in the end of the day that, sorry, I can't focus right now. But at a neuroscience level, that's your cognitive functioning, which is not working properly. And that's your answer for that.
Absolutely, absolutely. And, the brain also has this fascinating, I don't know if I can call it a housekeeping service, which is called the lymphatic system, which uses the cerebrospinal fluid to eliminate the waste and the toxins.
Yes.
Again, a process that is highly dependent on optimal hydration. So do you think we tend to underestimate the role of water in protecting the long-term brain health?
My goodness, Ms. Agarwal, you've done your research. I bet you've learned a lot of neuroscience researching this.
Well, tip of the iceberg, but yes.
So the brain has system called the CSF, as we call it, cerebrospinal fluid, which runs inside your brain, outside your brain, goes down to your spinal cord, and it circulates from within the brain to outside of the brain. From outside of the brain, it goes back into your bloodstream. So it's like you're recycling fluid in your brain. Just like your body. If you eat something, if you drink something, and body has to get rid of it, kidneys are your filters which filter everything out.
Absolutely.
In the brain, we have our CSF. So there is continuous production of CSF inside the brain. There are certain parts of the brain which is slightly out of the context of the podcast, but these are the areas which make CSF. CSF then flows inside, back to your spinal cord, comes up to your outside of your brain, and it filters out all the byproducts which are there. So like we're talking right now, we are really focusing hard right now. So our brain is in sort of hyperdrive at the moment. So we have what we call as the frontal lobes. Frontal lobes make us think, make us executive planning, and helps us to formulate the plan, so to speak. Right now, it is really functioning as we are talking. But like everything else, like in a car, when the car fuel burns, it gives byproducts as well. Same thing happens with the brain. So there are byproducts of this because the body is using up all the energy. CSF's job is to actually flush those things out and put it back into the bloodstream. And from bloodstream, it goes to various parts of the body where it can be either recycled or restored, or filtered out by the kidneys out. So if the CSF flow, for some reason, gets blocked, that can lead to quite significant problems. Because it's like the system will start to swell up because there is no flow going on. Byproducts will start to get collected in the brain. And the commonest symptoms, if the CSF stops to flow, are headaches. Some children can get severe vomiting. They wake up in the middle of night, vomiting sometimes, irritability. And in rare cases, this can lead to quite severe neurological complications. So it's hugely important that that system keeps on flowing. And water plays a huge role in that because it keeps the CSF fluid, so to speak, and move through the brain.
Absolutely. So, like you said, I mean, water does play a very important role, but too much of anything can be harmful. And in conditions like maybe a traumatic brain injury or a stroke, excess fluid can become very dangerous and lead to a brain swelling or a cerebral edema, as you just mentioned. How do neurologists manage this delicate balance and prevent the fluid from becoming a threat to the brain?
Yeah, again, this can be a huge complication, the excess of fluid in the body. In majority of the situations, as we call it, the normal homeostasis, which is people just sitting in front of each other, talking, walking, and so on and so forth, the body is in a homeostasis. So you can drink 1.5 liter water, it is absolutely fine. As an adult, you can drink 2 liters of water, that's absolutely fine. The body will try to get rid of it. If you keep on drinking water more than that, of course, it will have a knock-on effect on the body. It will try to send the fluid out, of the excess fluid out. But sometimes, particularly in elderly people, in people who are a little bit older, you must have heard that many people who are elderly will come back and say, my sodium has dropped. You must have heard that. It's very common. It's not in my practice, but in elderly people or adult practice, it's quite common. We advise, or the adult physicians or neurologists advise them to not drink too much water because you're sort of diluting your system and your sodium levels can drop.
Right.
So excess of that is not very good. At a young age, the body is trying to compensate as much as it can. Now, coming back to the point of what you discussed about cerebral edema, that is a very catastrophic neurological complication. And there are many conditions which can cause that. And like you mentioned, traumatic head injuries is one of them. And then there are other ones as well, which we'll commonly see in our hospitals environment. And unfortunately, when a child has cerebral edema, they land up in pediatric intensive care more often than not. So it is an emergency situation. What happens, and I'll give you an example of that, is when some sort of injury happens to the brain, the cells break down. When the cells break down for any reason, they release the toxins into the intracellular space, which is the space between those cells. Those kind of products which go into the intracellular space, then they pull water with it. If you heard about the word osmosis as a layman, when we were kids, we used to talk about it, that the water will flow where the minerals will flow. Right. Similar thing happens in brain injuries for any reason. The water then comes out into the extracellular space, which is between the two cells. That causes swelling of that space, and that swelling is called cerebral edema. Now, if the brain keeps on swelling, Imagine there's a pressure cooker which can't be opened, which is made up of, our skull is hard. Imagine like a cooker, which is made of steel, and there is water boiling in it, and which the pressure is going up. The brain has got nowhere to go. It's a soft kind of organ because the skull is hard. So then the brain, all it can go is down into your spinal cord, and that can be a disaster for the patient. So cerebral edema is something which is not nice, nasty, and has to be dealt with very quickly by the intensive care team. And there are various things which we do, something called neuroprotective measures, again, which is outside the scope of the podcast. But those neuroprotective measures are meant to protect the brain from swelling even more and causing edema or cell death.
Wow. And but beyond hydration, if we talk about water, it also plays a very vital role in clinical neurology. And water therapy, because it has a unique ability to counteract the effects of gravity, enables the patients to move, to relearn, and sometimes recover in ways that may not always be possible on land. So in your opinion, doctor, how important is water-based therapy in supporting the neurological recovery?
Immensely important. Hugely important. Wow. I think what you're mentioning here is basically what we call as hydrotherapy or aquatherapy. Yes. That's something which we commonly do in our practice. This is used more, if you talk about a couple of scenarios here. One is a neurodiverse child, and other is a neurotypical child. Neurodiverse children are those children who have any form of neurological or neurobehavioral issues or problems. A neurotypical child is any child who goes to the mainstream education and is completely normal population, so to speak. In a neurodiverse child, there's a group of kids who have something called cerebral palsy. Cerebral palsy is a condition, as the name suggests. Cerebral means brain, palsy affected for any reason. And the most common scenario is that these children unfortunately had a incident at birth or around the time of the birth, which had led to permanent brain damage. And that permanent brain damage is causing them problems with their muscles, with their walking, talking, and so on and so forth. These group of children need regular physiotherapy. That's a common thing which people know about physiotherapy, which is how your muscles are functioning. You go to a specialist pediatric physiotherapist, which we do at Neuropedia, that's what we do. And we help them to mobilize better and help them to attain their daily living, so to speak. One of the huge important parts of that physiotherapy or arms of physiotherapy is hydrotherapy. And we really recommend every child who can avail this facility to go and take it. Why? Because hydrotherapy is thought to be weightless exercise. When you're doing physiotherapy, you're actually, for example, making the child to stand up who is on wheelchair, but you're helping them to stand up. They're using their own muscles, own body weight to try and stand up. That is hard. That's very hard. And imagine a child and a parent who has to go through this every single morning. It's difficult for them. Right. Hydrotherapy, on the other hand, is basically, like I said, weightless therapy. And they really enjoy it. When they're in the water, they can really work on their muscles without being worried about the weight they have to bear. And the physiotherapist who's doing hydrotherapy can do a lot more with these children in water. Right. That's one effect of that. The second effect on neurodiverse children is the touch of water. So you would have seen that young kids really enjoy going into the pool. And the reason for that is the touch of water. Water has a sensory function. Many children we come across in neurodiversity is something called autism. You may have heard about autism. So autism spectrum disorder is a neurobehavioral condition. And in that condition, kids have a lot of sensory problems. They don't like the touch. They are picky eaters. And different sensations are heightened. Those kids enjoy water like anything. Because when they're in the pool, the touch of water really calms them down. And I actually prescribe therapy for this, for the kids with ASD. Go to the swimming pool twice a week. You will see that your kid is much more calmer. Their behavior is much more settled. And they sleep very well. Wow. Because sleep is another problem they have. So for neurodiverse kids, water is essential. On the other hand, neurotypical kids, they love swimming pool. And the reason for that is, again, the same thing. It improves their cognition. It helps them with the sensations, with the sensory. It really helps all the kids to just, have a lovely mood. Water enjoys the mood. Imagine sitting by the sea, sitting by the river. It lifts your mood. And that's the effect of water.
Wow, so beautifully explained. Thank you so much. But moving to water quality, now there are some research that also say that the heavy metals and the other contaminants in the drinking water can increase the oxidative stress and potentially raise the risk of neurodegenerative conditions like Alzheimer's disease and dementia. So, how strong is the current scientific understanding of this link?
That's a bit of a contentious question, I would say. Because when we talk about medicine, we usually talk about cause and effect. And you specifically mentioned the words dementia and Alzheimer's. These are multifactorial. The reasons why these conditions happen are multifactorial. It's not just one thing. Genetics plays a very, very important part in Alzheimer's dementia or other forms of dementia, also called as frontotemporal dementia. Genetics has a huge role in it. And then there are environmental factors as well. I mean, one must not forget that purity of water is very important. Right. And if we go back to 1970s and 1980s, in various countries which were underprivileged, not anymore, kids used to have a lot of lead poisoning, if you remember, because they would eat the paint off the walls, which had lead in it, and that would cause lead poisoning. And one of the things which happened with lead poisoning was neurocognitive problems and other conditions which can cause neurological deterioration. So the science is there. But linking it with just water, I think that'll be a little bit tricky one to say that this is just the cause of Alzheimer's and dementia. Not to say that if your water is contaminated and you have heavy metals like lead, arsenic, mercury, and so forth, will not cause problems. Of course, that'll cause neurodegeneration if you keep doing that over long periods of time. Right. So it is very important to have, for everybody on this planet, to have clean, potable drinking water. It's very important, and that's one of the things which you are doing. And I salute you for you and your company for doing that.
Thank you.
It's an amazing thing which you're doing, by the way. So to answer your question directly, dementia, Alzheimer's, they are multifactorial, not just the intake of water attached to it.
Fair enough. On a general note, doctor, these days we see children with screens. They're just surrounded by screen, and it's almost become like a way of life. It's a lifestyle today. What difference in the brain development or issues that you're seeing today that were rare or not as pronounced maybe 20 years earlier?
And that's something which comes up in my practice on a daily basis, actually. As you know, the smartphones have come in the last 20 years. We have got now 2 decades of experience with the smartphones. In my pediatric practice also, I've seen a huge shift, a paradigm shift in how the kids are presenting. What we rarely saw as a general pediatrician or as a medical student, we are seeing it very commonly. The most common thing which we see with the huge excessive screen time is poor focus and attention. Children are finding it very difficult to focus for long periods of time now.
Yeah, the attention span is going down.
Very, very low. It has become like a social media attention span now.
Yeah.
If you look at the social media also, most reels which you see are for 20 seconds. 30 seconds. And the reason for that is because the social media also understands that people cannot focus even more for 20 to 30 seconds to see a reel.
Yeah, they don't have the bandwidth.
Correct. Now, I'm just thinking, we're talking for the last 25 minutes. Who's going to listen to us for so long? I'm thinking.
I'm sure we'll find enough people because, thank you. You're making it so interesting. I'm sure they'll love it.
So the focus and attention span is just phenomenally down now.
Yeah.
Sleep has become a huge problem in kids now. You will be amazed as to how many parents come to me saying that my child is not sleeping well. And when we probe the history, what time do you go to sleep? Usually at 1 o'clock in the morning.
Ooh.
And what were you doing till 1 o'clock in the morning?
Screen.
I was watching my screens, phones, and so on and so forth. Right? And then I couldn't sleep properly. Well, there is science behind it.
Right.
The science is that you've got to stop watching your screens 30 minutes before your sleep time. Reason for that is what you're watching on a digital screen will come in your dreams more often than not. The science behind it is that what you're watching on the screen plays in your brain as well. And that can give rise to lack of sleep, sometimes nightmares in young children. Many young children wake up with screaming who have watched those cartoons which had some sort of violence in them. So that causes sleep problem. And then 6 o'clock in the morning, you have to go to school. So you're ending up with 5 to 6 hours of sleep, Well, what are you going to happen in the morning? You're going to have headaches in the morning. So it's all linked to each other. So unfortunately, screens create a lot of problems. That is neurotypical children. Now let's talk about neurodiverse children. There are clear studies now that a huge proportion of children who are watching screens, particularly who are under 2 years of age. So there's a big study from Canada which said that if you are 2 years of age or under and you watch more than 2 hours of screen time a day, you have 1/3 chance of getting speech delay. You have a huge chance of developing autism spectrum disorder, even though ASD is a multifactorial disease. But the environmental factor of excessive screen time is definitely there.
My God.
So people have to pay attention. And nowadays, as you can see, many places, they are now banning social media in children. And really kudos to the governments who are doing that. And everywhere I see now, people are waking up to this.
Yeah.
So it's about time now that this thing should be controlled.
No, I agree with you totally. So speaking of which, what are some of the early neurological warning signs that parents often overlook?
And there are multiple divisions of that, or multiple neurological signs and multiple conditions as well. So I would go on to the most common ones which your audience will be watching. And I will not go into the complex neurological conditions. Let's just talk about headaches first.
Okay.
That's the most commonest one.
Okay.
People ignore headaches because they think, oh, I had headaches as well. My child also had headaches, nothing to worry about. But headaches can have a huge impact on a children's daily life. Headaches can affect their learning, because if you can't concentrate, you can't learn. Headaches will affect their sleep. Headaches will affect how they engage with their friends. And their social kind of life is also affected. I'll give you an interesting story.
Of course.
Again, I've not said this to in any podcast. And here I can say that. When I came to this country, I was doing a clinic. And this 7 or 8-year-old boy came with the parents with headaches and migraine. So I diagnosed him with migraine, and I said, these are the things which you need to do. You need to drink plenty of water. You need to drink at least 1.5 liters of water every day. You need to cut caffeine, because caffeine is one of the most important factors which causes headache as well in children. I said you need to cut caffeine. For example, you have to stop taking chocolates or reduce chocolates. You got to stop drinking colas, which fizzy drinks, which have a huge amount of caffeine in it, until your headaches get better. Now, I just had my lunch before that, and I'd come back from my lunch with a can of cola in my hand.
Oh, goodness. That's not a good example.
And I had left that cola on the side of my table. I tried to hide it before I tried to hide it, but somehow he saw it. He saw me walking into the clinic maybe when I walked in. And turned around to his mom and said, but Dr. Aman was drinking cola. If he's drinking cola, why can't I? And I went red on my face. My secretary looked at me. We both smiled at each other. To this day, I made sure that if I'm preaching something, I better practice it as well.
Yeah.
This is something which we learned as a kid.
Yeah.
But this was my own experience. I try my best. If I drink a cola, I make sure that I'm hiding it from children. And certainly not put it on my clinic in front of them. So headaches can occur because of excessive caffeine. Migraine can occur because of various triggers. For example, cheese as well can be a trigger.
Really?
Yeah, cheese is a big trigger. Cheese and chocolate, big triggers for headaches and migraine.
Okay.
Lack of sleep is another one. So people should not ignore headaches. And then there are other conditions which can be nasty as well, which needs further interventions, brain scans, and so on and so forth. So if your child, or anybody listening to this podcast, has headaches, their children have headaches, please go and see your doctor straight away.
Yeah.
And the second condition which I really need to talk about again, which is hugely prevalent now, is early signs of autism spectrum disorder. Autism spectrum disorder is a neurobehavioral condition. So one of the conditions which people should which I want your audience to know about, is autism spectrum disorder. ASD is a neurobehavioral condition, which means the children are usually born full-term normal. They have no complications after birth. In the first year of life, there are no issues. Their motor skills are completely normal. And then when in the second year of their life, you would start to see some sort of regression. For example, the words which we were saying before, they're not saying anymore. They are not socially interactive as they were before, but their motor skills are still fine. They're running around. So if the parents see these early warning signs, which are, first of all, poor eye contact. So if an 18 months or 2-year-old child has poor eye contact, is not looking at you, that's a very early warning sign. Second early warning sign is that a baby who was, when you call the baby at 1 year, they're responding to their name. Now at 18 months and 2 years, they're not responding to their name, and they're running around in the house as if they can't hear you.
Right.
That's a second early warning sign. And the third one is pointing. So if a baby is not pointing to objects with the finger, most babies do that at 18 months. If they want something, they'll point. So if a baby is not pointing, then that's something to worry about. Please don't look away. As parents, we want our children to do well. All parents want their children to be neurotypical. But every parent knows deep inside them if something is not right with their child. Don't look away.
Yeah.
There is help available. Just go and see a pediatrician, neurodevelopment pediatrician, or a pediatric neurologist and get this diagnosed early. And the reason for that is because early intervention helps the children with ASD to improve very quickly. So that's what we do at Neuropedia and Child Development Center. We help children and community, help them to diagnose early, treat them early, intervene early, and try to bring their neurodevelopment trajectory as close to possible as where they should have been.
That's very meaningful, and thank you so much for sharing that. I'm sure a lot of them are going to, be intrigued, and they'll probably use that information to help themselves and their children. But science has improved, treatments are improving, everything is advancing. Do you think the mindset or the outlook of people is also changing towards conditions like autism, ADHD, cerebral palsy, and epilepsy?
So we've come a long way. But there's still a long way to go. There are still lots of taboos attached to the diagnosis. Now, epilepsy has been there for centuries, but it's a huge taboo still. The way I tell the families is that it's a condition, not a disease. You treat the child, and the child gets better. In majority of cases, there are lots of celebrities, sports personalities who had epilepsy. That didn't stop them from becoming, captains of their international teams. Right. So it is not a disease at all. If your child's MRI brain or structural brain is normal, if your child's brainwave test called EEG is also normal, and they have seizures and epilepsy, they have a huge chance of growing out of it. You see a pediatric neurologist, meet them, treat them for 2 years, and most likely your child will grow out of it and lead a normal life just like before they were leading a normal life. They've got to do what they have to do. Just have to be a little bit cautious though. So if your child has epilepsy, like you mentioned, if they're going into a swimming pool, the lifeguard just needs to keep a watch on them.
Right.
They can go swimming, they just need to be watched. If they go biking, cycling, they have to put a helmet on. Just take normal precautions really, like any other child will do. Regarding ASD, like you said, that the information which is now out there is quite a lot for the families now, which wasn't the case 10, 15, 20 years ago. Now there's a lot of information which they can avail. Yes, the parents are also getting very much aware of this condition because the schools are also much aware of this condition now. So it becomes a responsibility of each and every professional, including us as doctors, school, a huge role to play, health professionals, special education needs people in the school. Yeah. So it is our job to make people aware of this condition because early intervention helps here. Yeah. So yes, we are getting there, but there's still a lot to cross. And various countries, if we talk about, let's say talk about India, for example, huge country, and it needs to, people need to be aware of this condition. Yeah. So the awareness campaigns like what you're doing right now is hugely important in raising awareness.
Right. Brilliant. And we're now entering the era of artificial intelligence. Oh, yes. So how do you see AI changing the way we understand, diagnose, and treat neurological conditions in the future?
AI has a huge role to play. Now, we talked about screens, for example, before, that screens can have a negative impact on it. But screens can also have a positive impact if it is used judicially. That's the key word here. Because if we overdo it, we're going to cause problems. If it is monitored and done in a proper controlled fashion, it can be very helpful. We just talked about epilepsy a minute ago. Let's talk about that now. Before, when I was training, we used to do a lot of scans, whatever we had. For example, CT scans and MRI scans, which were a little bit less magnified. Now the scans are much more magnified. and there are even small lesions in the brain which we were not able to pick earlier. AI can help them detect very quickly now that there's a lesion here which is causing seizures, which we were not able to do before. Once we diagnose somebody with epilepsy, we do many other scans like functional MRI scans, other special scans, and AI helps us to again detect the areas where the brain is having seizures from, which we were not able to do before. The surgeries are also going to get evolved now. AI will help us locate those areas much better. And even in future, robotic surgeries with AI are coming through, which will help us to remove those areas very quickly. That's just a small example how it is helping. There are many tools coming now in which AI can detect neurobehavioral conditions like autism spectrum disorder very quickly. We have a simple test called TOA test, for example, for ADHD. TOA test is a quick tool which anybody from the age of 6 or 7 can, up till the age of 90 can do. And that AI helps to diagnose, that software helps to diagnose ADHD very quickly before you see a psychologist. So AI is here to stay. AI is going to help us, but we have to remember that it is only a sort of a co-author. It is not the real author here. So the doctors or the professionals or in any other field, they have to be the one who should be leading it and just taking help of AI rather than completely wholly being dependent on it.
No, for sure. So coming back to water and to human instincts, I think human, as you earlier mentioned, we feel drawn towards the sea and the ocean. And, we also believe that being close to water, can reduce stress and also improve our mental well-being. But from a neurological perspective, how might that be? In the sense, do you think nature can really play a role of a therapist?
Absolutely. There is no doubt about that. When we were growing up and we were kids, I'm talking about myself, you were much younger. When we used to watch these films where people will say, okay, I'm going to go to the mountains and live there my life peacefully. But there is reason behind it. Because being close to nature really helps your body in general, particularly your cognition. And there are studies behind it. Japanese have a very important, a great model of therapy. So they make their psychology units or mental health units in the nature. And people who are getting treated for mental health issues, for any kind of level, they advise the adults or young people to go and spend time in the nature, sit by the river, and that's part of their therapy. That's part of their program. And I've seen it personally as well, that when kids who have cerebral palsy, for example, and we send them to hydrotherapy, which is being in nature in an artificial way, so to speak, it really helps them physically and cognitively. Their mood improves. There is a medical term called soft fascination. There's a medical term for that, in which our brain starts to function better. The neurotransmitters start to flow better when we are in nature. Running water is a very important factor in there. So you would also, everybody knows from the experience that when we're sitting by the river, we feel just calm. And that is part of the neurocognition there. The way your connections of the brain starts to flow smoothly is because of this particular term, as we call it, soft fascination. And that is to do with the nature, particularly the flow of the water, the sound of the water. It helps the brain to calm down, helps the brain to function better. And it improves neurocognition.
Beautiful. Doctor, we have a round of rapid fire questions for you. So one neurological myth you wish would disappear?
Autism cannot be treated.
Okay, fair enough. A book every parent should read?
I think every parent should read any book they want. Whatever genre which you like, you should read. And the reason for that is, when you read a book, a part of the book then stays with you. And you can bring that positivity in your life once you pick up from that book. And that positivity will reflect on other people around you. And I know it's a rapid fire, but if you don't mind me answering, I call it the social footprints. So like we go on the internet, when we search for something, we leave digital footprints. Similarly, you leave your personality footprints on people when you meet them. So whenever you meet them, you put your positive footprints on them and when you leave them. And the books play a huge role in that. So I think every person should read a book.
Read books, basically. So the human brain gets smaller as we get older. Is that true or false?
Yeah, so partially that's true. Particularly, it's not so much true in the beginning. So as you're growing from 0 to 5, particularly 0 to 2, your brain is growing exponentially. Up till 5, a huge number of connections are being made in the neuron. And that continues to happen until you're teenage. And now we know the studies show that it continues until the age of 30 and beyond as well. That's how it is now. But when you grow older, particularly when you're very elderly, the brain does start to have something called atrophy, which is age-related atrophic changes. Atrophy means shrinkage. So that happens in quite late in elderly people. But, until your middle age and all, you're fine.
Interesting. Okay. Reading out loud uses different brain circuits than reading silently. Is that true or false?
Partially true, not completely entirely. So when you're reading something, you're looking at it, your visual sensations are working. Then those visual sensations then evoke those areas of the brain which are learning areas of your brain. So that is the most important part, because when you're reading something, you're trying to imbibe it. So that is truth part of it. The partial truth is when you read out loud, what happens is your auditory, or the way you hear as well, also gets engaged. So it doesn't really help you imbibe the information. Maybe it helps with the recall of the information, maybe. So that's why it's partially true.
Because there are two senses working.
Correct,
there.
because your auditory sense is also working there. So not entirely true, and it is from person to person. Because some people, when they read out loud, they actually forget things. Because their auditory or the hearing part is overwhelming for them, and they can't retain the information.
Okay.
So it ranges from person to person.
Fair enough. We often separate mental health from brain health. Should we?
So brain is a structure. And the function of the brain is, in layman terms, how your mental ability is. So it is related, but slightly different as well. As a neurologist, if you have structural brain problem, you can look at the MRI scan. But if you have a mental, so to speak, issue, MRIs are most likely to be normal, most likely. So they are connected and unrelated in the same way. Like I mentioned.
Yeah, fair enough. What is the most common neurological condition in children today?
There are numerous neurological conditions which we come across, but I think headaches is the most commonest one which we come across in our practice on a day-to-day basis.
What unanswered question about the brain still keeps you curious?
My goodness, you're really pushing me now. One question which I really think about is, what capacity of our brain we use on a daily basis? Yeah. And what will happen if we unlock the full potential of our brain? Yeah. I really don't know. You watch movies, you see fictional movies, and then they say that if you unlock the full potential of the brain, you can transport yourself from one place to the other, you can levitate, you can do this and that. I wonder sometimes that if I am able to unlock 100% of my brain, what can I achieve, or what can anybody else achieve?
Yeah. Wow. That's quite intriguing. So before we let you go, we have a little something that we'd like to give you.
Oh.
So this is a big water air purifier, and while you enjoy clean air, Big Water will also give 200 liters of clean water to the underserved communities on your behalf.
That's amazing. Mr. Agarwal, this is what I mean, that you're doing a great job. People have corporate responsibilities, social responsibilities, but I think yours, people call it corporate social responsibility. I think for you, it's social corporate responsibility, because the amount of social work which you're doing by doing this is just phenomenal.
Thank you. And your work brings hope to, countless families that are navigating neurological challenges. So thank you so much for your commitment to helping children reach their fullest potential. And thank you so much for taking our time and being with us on this conversation.
Thank you very much indeed. The pleasure is all mine.
Thank you. And thank you all for being with us. Stay tuned. Know your water. Love your water. Cheers, guys.